SVS, which is the stock visibility system training of the NDoH. And I will also take this opportunity to allow us just to touch on some of the concerns that our colleagues have been raising with regards to the current vaccination program or the trial of Sisonke. And we will also take this opportunity to touch on other matters like the vaccinator program, the section 22A 15 from the South African Pharmacy Council. We will touch on the master file list, master facility list, which is also at the Department of Health, just to clear the path for everyone and ensure that we are all on the same page in terms of the current program that is currently ongoing. I acknowledge that it has been a lot coming from different sides, and some of us were unable to really grasp where to start and where to go. But I believe that the office has been doing a sterling job in clarifying those confusions, as well as helping out where there seem to be some areas of lack of understanding. Now, this current training of tonight will also clarify how to move forward in terms of registrations for vaccination, as well as the vaccinator program. And without further ado, I also want to thank our team that represent us at the B4SA, Dr. Mutli and Jackie, for having secured that 10,000 units of vaccines on behalf of ICPA and generally the independent pharmacy. And I know and I note the concerns that is currently for the healthcare workers that are registered with the SAPC, as well as registered with the South African Nursing Council. And I know that we also have staff members that are not necessarily registered as such, but I believe that they will also be covered immediately when we finish the current program of the healthcare workers. And while I'm still on that, let me also use this opportunity to indicate to the membership that ICPA continue to lobby as it did before, like we lobbied the Solidarity Fund with regards to the testing. And we are happy to announce that we have done testing to the tune of about 16 million, which is quite a number, and it's really supposed to be recorded and credited to the ICPA as well as the Solidarity Fund on that collaboration. And I just want to reassure the membership that we continue to work hard and lobby more to see what costs can we try and cover on behalf of our members as we reach particularly the phase 2. And it is also important to note that our students through SAPSIF have also been brought on board by the ICPA to volunteer during phase 2 with regards to the rollout and the assistance thereof. So I must tell you that the students are very eager to come through and become volunteers in whatever capacity that you may deem fit, so that they ultimately can participate in this momentous program. You will note that we are currently still on phase 1. We still need to go to phase 2 of the 40 million. And I believe that our members as ICPA, we are getting ready to ensure that our social responsibility with regards to the rollout is taken out. Now, I know that also that there are concerns with regards to remuneration of these programs. I can just tell you that in principle, the National Department has agreed, although it is the quantum that is still to be determined, how much we will be getting as we assist them in rolling out this vaccination program. I just want to encourage our members to please participate in all these programs. Let's not forfeit the 10,000 units that our B4SA representative have managed to secure, and ensure that it doesn't go to waste, because it can easily be forfeited to other people that are able to then consume it. And it is also important to encourage membership to participate in the vaccinator program through the registration at the South African Pharmacy Council, where you will be you're required to be grade B or grade A pharmacy to be able to be a vaccinator and then you can get your certificate as a Section 22A15. So with that, I just want to say, as a call to action for our membership, let's not allow this opportunity to pass us by. Besides the social responsibility that we carry in our respective communities, let us also remember that if we do not participate in these programs, we know who will come through on behalf of the department. The corporates will seize the opportunity and look good in front of the department, and we will continue to complain on the sidelines. So with that, I just want to say, please, let's be on the ball. Where there is consent, let's clarify them, let's iron them out, but let's assist our nation in these times of need throughout this pandemic. With that, Jackie, I just want to give you the opportunity to start with your presentation. If possible, somewhere I would ask Dr. Moodley to just clarify all the processes that he has been trying to clarify through the WhatsApp group, respective WhatsApp groups, trying to assist in terms of the registration glitches, challenges that membership is facing, as well as any other concerns that may be raised, so that the uptake for the SVS can also be good. We don't want it to be discouraged by the current challenges we are facing with the V4HCW programs. So with that, I want to say thank you for your time. And I believe that this training will come in handy for you so that you can also have some answers for some of your colleagues that couldn't make it tonight. And I believe that it will be fruitful and helpful, and then we can be able to move this program forward and vaccinate the coming 40 million of our populace. So with that, I want to say thank you, and please, Jackie, do the honors on our behalf, and we will take it from there. Thank you so much.
Thank you very much, Chair, and good evening to everybody. Chair, I would also like to welcome the PSSA. They are joining us tonight as well, and I think we've got Dr. Marit Eckstein is on. I recognized her. She's joining us. At this point, I would like to, let me just get my screen going, and let me get rid of this. Sorry.
Welcome, Marit. Welcome, Marit. Welcome, Dr. Eckstein.
All right, so I'm going to ask for Sham just to give us a bit of an update. And if I can ask everybody, please, to mute. If you could all please just mute yourselves. And then I'm going to ask if Sham Moodley can give us an update on the vaccinations. I believe he had his vaccination today.
Yes, thank you very much, Jackie, and thank you, Chair. You see some sounds coming through. Can you hear me, Jackie?
Yes, there we go.
Loud and clear, Dr. Moodley.
All right, great. I also saw the president of Pharmacy Council on. I know he's here as an ICPA member, but we haven't seen and I would like to acknowledge him on the program tonight. Chair, let me give you a quick report back on what is going on with the vaccines at the moment. Yes, I was one of the very, very fortunate ones in the country today to have gone in to an amazing site. I think those of you that went in and got your vaccines at St. Augustine's, they've done an amazing job with putting that package together. It ran like clockwork, and I think when I saw my watch when I got the vaccine and walked out, it was 28 minutes, and I just had to basically sit there for the 15 minutes at the end. So let's just go back a little bit and start off with why we in this phase where we have these multiple registrations and everyone's complaining about processes and all that. Just to remind you, we started off with the AstraZeneca vaccines, and we had delivered at our door 1 million vaccines, if you remember that. And at that point, before we had the delivery, we had literally all of you that have volunteered to come onto the program and accept the vaccines, including your staff, whether they were cleaners or persons on the till or drivers. We had them all registered those that filled the initial forms, and we had them submitted and ready to take the AstraZeneca 1 million vaccines. That would have covered literally every health worker in the country, including pharmacy as the frontline staff. So to get past that, then that vaccine was pulled out because, and I'm not going to go into the details of that, we then got allocated the Johnson & Johnson study vaccine. So it's critical to understand that what we're dealing with here is not a commercial vaccine that comes in millions, but the J&J vaccine, which is really the study protocol at the moment. So J&J started to come in batches of 70,000 to 80,000 per 2 weeks. And then because we had to vaccinate 1 million workers, government had to re-strategize and decide who we're going to start with. So there was some science put into that, and they decided this is the way to go. And we had to follow the queue and wait for us to be identified as part of that. And I must say that I know a lot of you might be wondering, why weren't we number one on the list? I can tell you everyone would like to be number one, but the strategy in government that we used was purely scientific, a lot of science behind it, and I totally agreed with the way we fell in the process to be nominated to come in. So at the point where we were put in, this was around the mark of around 260 somewhat vaccines, 260,000 vaccines being delivered to healthcare workers. We then fell into the category of saying, we are going to allow you 10,000 of your essential staff, which is pharmacists, post-basic, and the nurse. All frontline, everyone else, they said, although they're risk, they're not at the point of where they're spending time with patients, and there was some time determination of that. So that's how we got the 10,000 vaccines across the pharmacy sector in the private. So in other words, the CLICS, DISCEM, PSSA members, ICPA members got allocated the vaccine. So then let's move on to what happened next. So ICPA then sent out a second schedule to be filled by each of the pharmacies so that you could then allocate who the essential staff were in those categories, put them on. One of the processes that we had to do in ICPA, CLICS did the same thing, DISCEM did the same thing, the PSSA did the same thing, is to go and verify that these were frontline, they were pharmacists, they were post-basics, and they were nurses. So once that data was accumulated, and I can tell you, not everyone filled that form. We suspect there was about 30 or 40% of our pharmacies actually went online and filled it. We managed to then upload that into the system. So, so in the 10,000 now that we're dealing with, what has happened is we had to use 3 processes here. One is the list that you filled from ICPA. We then sent that to a platform to upload. And we paid for each of you that filled that form. We paid for the cost of that. It cost $260 to do the upload. So if there was 1,000 people, you can work out the calculation on that. ICPA actually paid the bill rather than coming back to you for the $260. We paid. It was altogether about 27 or 26,000 rand that we paid to use the system. So all of the data you submitted to us got uploaded into the vaccine platform, the V4 for health, Vaccines for Healthcare Workers site. And that site then, once it got curated and you were in the site, you were asked to do a couple of things. One, go check that you were on the EVDS and registered. That's the first thing you had to do. Secondly, you had to go to the V4 vaccine site and fill in your details and book a date and time for wherever the sites were being allocated. So that's the next process they had to do. Once you've done that process, you then, that process talked to the EVDS to say, this is an essential worker classified as such. You got released to be vaccinated, and that whole process of the EDVS started. So the EVDS then went into the mode where they sent you an SMS. The first SMS said, you're qualifying for this vaccine. Then they sent you a second SMS to say, in order to accept this vaccine, which is a study vaccine, you needed to have gone through consent with Sisonke. So then you had to fill in that consent form, and when you click the button there, it said to you, you were successful, and that went back to the EVDS system where you were waiting for the vouchers. Some vouchers arrived immediately, some the next day, some in the evening. So people got it at different times. And I think it was just how the system works and gets uploaded. So you got the voucher, then you went back and looked at your date of booking at the V4 healthcare worksite, and combined with those two, you went and got your vaccines, which I did today. So that's how that process worked. And if you didn't follow that, there were a number of barriers that we encountered over the last 24, 48 hours. One, people did not fill the initial register. If you didn't fill the register, you were not uploaded into the system. So you don't exist at the moment. As far as the EVDS is concerned, you are there like any other person in the country, but you've not been put on the priority list to be vaccinated. So that's the problem that we encountered first. The second problem is some people put incorrect details, cell phone numbers, etc., went to the wrong place, vouchers were issued to the wrong people. Next thing is, when you went onto the EVDS and confirmed, you had to also do a booking on the V4 health worker site. People did not do that. Then the next thing is that when they got the Sisonke one, they did not fill that form properly and accept that the consent. So all of those were barriers to the point of where some of them didn't get the vouchers and didn't get a date and time. So those were some of the issues. So just, Jackie, if you can just put up that slide to conclude. So let me just tell you about the data and stats. So the office, together with the PSSA, clicks, Discam, etc., loaded 7,366 onto the master listing file. So we were allocated 10,000, but we couldn't even get a lot of the independent pharmacies to actually fill that register to be put on. So we had 7,366 registered people on the master file listing. Of that, 1,921 actually got registered because either there were problems with the system, with the information that was supplied, or you just didn't follow and go and complete that process. Then people that did get onto the register, the 1921, only 616 of them actually went and made a booking to get the vaccine today or tomorrow or the next day. That's the problem. And of that now, the EVDS issued 655 voucher numbers so far. So obviously vouchers will be done tomorrow and the next day and some next week. Already I can tell you on the Durban site, the St. Augustine's, they fully booked up to next week. So if you didn't get a time or a date, you're gonna have to go to another site in Pietermaritzburg maybe. What we are doing is talking to Sisonke to see if they can release some of the other vaccines that they have back into this site because it's a convenient site, especially for the local area. There are more workers that we need to do in the Durban, Greater Durban area. So that will happen in the next 24 hours. And you can see along the side that the total of accepted vaccines so far. Thanks, Chair. I hope that was useful.
Thank you very much, Dr. Moodley, for the precise presentation. And indeed, it is helpful. Let's just continue to encourage each other to make those bookings, to make those registrations, so that ultimately we can consume according to our initial registration, which was uploaded through our master file. 7,366, obviously, if you do your numbers and look at those that have been actually vaccinated now, we are still a little bit far, but let's just keep on. It's not too late. Thank you very much, Dr. Moodley. Jackie, over back to you.
Thank you, Chair, and thank you, Sham. So I'm going to just quickly give a bit of an update on the pharmacies that have applied to be a vaccination site. So we are about to go into phase 1B. That's the beginning of the commercial vaccine, the Johnson & Johnson vaccine. We have 350 pharmacies that will be rolling out the vaccine to the rest of the healthcare workers. Of those, 68 are ICPA members. So ICPA at the office, we have loaded and submitted all of those to the Pharmacy Council. Pharmacy Council has curated and approved all of them. If I can just say to everybody that has applied for phase 1B, please look out for the token, because the bottleneck at the moment is these tokens or emails from council have been sent out to all the RPs, but there are a lot of the RPs are not clicking on the link and completing the compliance questionnaire. That questionnaire is essential for you to receive your Section 22A15 permit. The other thing that's done is the capacity and allocated healthcare worker information has been sent to each of the phase 1B pharmacies. The registration on the SVS, which is what I'm going to be doing the training on today, has been sent to the platform for uploading. The orders, which the phase 1B pharmacies would have seen how many vaccines they're going to receive, those orders will be coming through either DSV or BioVac, and we will inform you at the time when that comes. There will be 90-day period before you have to pay for them, and we will talk a bit about that as well. The ancillary items, the syringes, needles, cotton wool, web coals, etc., those must be ordered separately. So the government has secured a tender for all of these items, and they secured sufficient for the public and private sector. So we're just waiting to find out how we would order those and what the prices would be. Then as far as the reporting and recording supplies go, ICPA will give you all the forms and everything that you require from that process, including an electronic vaccine passport, which you can then print in the pharmacy, which you need to give to each person that you vaccinate. What I do suggest is that you have a dry run to test your process flow ahead of starting the vaccinations. So here, just to quickly take you through the immunization process, it should take about 30 minutes. It's basically 6 steps. So at the pharmacy entrance, you'll be wanting to do a symptom check where you take temperature and ask a few questions. They will then go to an eligibility screening area, then to a waiting area. From the waiting area, they'll go to the registration. Either that will be done by your admin person, or if you only have one sister, the sister may be doing the registration, ID check, and the vaccinating. There's a medical screening and an informed consent, and then obviously the vaccination. So the first 6 steps take 10 minutes. The vaccination itself, drawing up the vaccine and what have you, takes about 5 minutes with the vaccinator. And then, very importantly, you need to have an area with social distancing where you can have the post-vaccination waiting area, where the person can sit for 15 minutes to be observed before they go home. Just to show you, here's a bit of a schematic. So if you've got people coming into the pharmacy, maybe heading towards your dispensary, they would need to go to a waiting area. There needs to be a registration area where your admin person will sit. From there, they can go into the clinic, and then from the clinic to the observation area. So very important that you have these 4 areas in the pharmacy somewhere before they leave the pharmacy. From the reporting supplies, you're going to require a case reporting form. This is for reporting adverse events following immunization. You'll need a case investigation form, vaccination cards, and obviously a paper-based recording form in case the EVDS goes offline. But we will be sending SOPs and all of these forms to each of the vaccination sites. As far as the vaccine goes, on the left is the Janssen or the J&J vaccine, as we call it. And on the right is the Pfizer vaccine. I'm going to focus on the J&J because most of our pharmacies will not probably have the Pfizer vaccine because it's a bit more of a tricky one to handle. So the J&J vaccine, the dose is 0.5 mils. It comes in a vial, which is 2.5 mils, in other words, 5 doses. It does not require a diluent, unlike the Pfizer one. It is already a suspension for injection. And as you can see, colorless to slightly yellow, clear to very opalescent suspension. What we will need from the ancillary items is a 1 or 2 mil syringe with 0.1 or 0.25 mil graduation. And then you'll require a 22 gauge, or for the larger patients, a 23 gauge needle. And those lengths can be 28, 32, or 38 millimeters. That is up to you. All right, I'm now going to take you into the actual SVS, or stock visibility system, and how you can use it on a web-based overview. There will be time at the end for questions. I'm going to go through quickly. This presentation will be available for everybody, and I am recording the session. So don't worry if I go too quickly, but I really want to have time at the end for the questions. All right, so what is the SVS? As I've said to you, it is an acronym for Stock Visibility System. It is a mobile application or a web management portal, which is used to monitor availability of medicines and other health commodities, including PPE. It's currently used in the state sector in 3,000 primary healthcare clinics and over 300 hospitals. It's widely used to support the prevention and resolution of medicine and health commodity stockouts. In 2020, it was deployed to the public sector hospitals to monitor PPE availability. And now it's going to be a platform for monitoring the availability of COVID-19 vaccines and ancillary items. You can see some of the key features on the right there. And I just want to stress that only sites that are storing the vaccine will need to use this. So if you have a site which is used for outreach or something like that, they will not need to register on the SVS. It will be sites where vaccines are stored. Why the SVS? Well, it's to ensure access to the relevant vaccine and ancillary item availability data so that the government can make decisions about access, availability, stock outs, that they can report. They've got to always have statistics on who's been vaccinated, where are the vaccines required, and it's for data standardization. It will ensure optimized and equitable distribution of the vaccine and all the ancillary items. If we have a quick overview, you'll see that you assign the stock, you can update the stock, and you can monitor stock. If we have a look at this, quite a busy diagram here, but if we start in the center here with the MFL. Now the MFL is the master facility list, and ICPA has been doing most of the work for members on the MFL. This is where you had to register your facility. It's where council has done the curation, and it is where you apply to be a vaccine site and that your permit process will start. So you can see up here on the left is the process of selection and identification of the vaccine sites. You then get a facility representative, which ICPA has been doing for ICPA members, enter them all in there. Once you're in the MFL and the process has started for the curation and the permit awarding, the next thing we need to do is to link with supply chain. So here on the left at the bottom, you can see this is where we need to link with the SVS. And this is very important for the forecasting and demand management to ensure that the vaccine is available where and when it is required. You'll see from the MFL as well, once you've received your permit, that vaccination site will migrate into the EVDS. And all of you who have registered on the EVDS to get your own vaccine will know that there's a list of sites. And so it's incredibly important, if you are a vaccination site, that you're in the EVDS so that a patient or a person can be allocated to you, or a person can select you as the site where they wish to be vaccinated. So we're going to go into the site enrollment. So there are 3 different methods to be able to capture data. There's a mobile app version, there's a desktop web version, there's an inbound API reporting version. Now we wanted to go for the inbound API reporting, and we have had all of the various IT vendors in a couple of meetings with the National Department of Health, but these things take time. And unfortunately, we need this ready within the next few days. So ICPA took a decision to go for the desktop web version. And the reason we've done this is that we all have computers at work. And if it's a mobile app, then that Android phone always has to be on the premises. And whose phone would you choose? So we took the initiative and we designated all of our pharmacies to do the desktop web version until our IT vendors are able to do it automatically through our stock systems. So important to note here is that for all methods of data submission, only one person per site can enroll the device using either mobile or desktop. So what we did at ICPA, we put the RP as that person. Once the registration is done, thereafter, any trained or knowledgeable person can submit the stock level data routinely. And since it's through the computer, it's very easy to log in, username and password, and submit your stock. But this is important that only one registration per pharmacy. So there's a single source of data. So I'm just going to take us through the desktop app version. So all sites obviously will need access to a computer. This can be a laptop or a desktop, and you'll need internet connectivity. We all have that because we claim daily from medical schemes. Each site will need a designated person. So as I say, we have put forward the RP, and an email with the enrollment link and enrollment code will be sent to the site's designated person. So we would have put forward the RP and we would have put forward the address that you registered your pharmacy with us. When you get the enrollment link, the email, you must click on that enrollment link provided via email and select Enroll on Desktop. Next, select Download to install the Journey apps on the desktop. This is a once-off. The Journey apps container will download to your PC. Then you can install it via Installation Wizard or however you normally load applications onto your computer. Once installed, you click on Launch, and you'll go back to that screen. All right, so selecting Launch to download it, you select Open Journeys app. So you open the app, wait for the device to download and install the app. Now, this will look like a mobile phone, and I've used this. This is actually from the mobile phone, but it will look the same on your desktop. So you will get a welcome, sign in using your company credentials. So you push continue. You then will be asked for your user enrollment code, which is what was emailed to you. You pop that in and you click on enroll. Please check at this stage that the correct site name reflects in the app. So it'll say Facility Weinberg Pharmacy or whatever it is. Please make sure that that's correct. And if it's not, contact the office immediately. After logging in, check that the site details are correct. So check your facility name, your sub-district and district, and the facility details must match your physical site. Report any inaccuracies immediately to ourselves. Now the app, it will look like a telephone on your computer, but you can drag the corners of the app to make it bigger. Especially like me, you get to a certain age, you can't read the small writing on the screen, so you can make it bigger. You can use the mouse to click on any of the buttons in the app to start using it. The application syncs automatically when connected to Wi-Fi or network, or you can select the sync icon, which is in the top right-hand corner, which will synchronize data after each upload is complete. Reporting requirements. So, how to update the stock levels. National Department of Health have told us that they expect us to report on our COVID-19 vaccine stock at the close of business every day. Now, this could seem onerous, which is why we were hoping that it could be done through our normal dispensing systems. But at this stage, you will need to designate somebody that at the end of the day, when you close your clinic, you upload the stock. And the stock updates that they will require are your current stock levels. stock expiry dates, stock received, stock lost, that could be breakages, pilferage, wasted, stock issued, and stock transferred. For the private sector, no ancillary item reporting is expected, so we don't need to worry about that. When we do have diluent for the Pfizer vaccine, that will be reported on a once-a-week basis. It's very important to ensure that the data quality, all fields must be updated with each data submission. Okay, stock levels can be updated using one of three methods. So you can literally select a single stock item. You can do something called a loop through the stock items. And then there is also the minimum basket reporting list. I'm not going to take you through all of this. You really don't need to worry about it because we're literally going to have a single stock item, which will be the J&J vaccine. But you pop in the your stock item, or you select your Johnson & Johnson vaccine. You click on the no value selected and a drop down to select your stock category. Next, you select a category from the options provided. It'll be vaccines, and then you select proceed to select the stock item. You again tap the no value selected drop down to select a stock item. And there you can see it. It's the Johnson & Johnson COVID-19 vaccine, single shot vaccine. Select the stock item. And then number 6, select proceed to update the stock levels. Update current stock level and expiry date. So there it's pretty self-explanatory, and it literally will take you through step by step. You need to enter something on each line or it won't allow you to go further. And then you click proceed once that is done. Lastly, review the details updated on the summary page and select proceed to submit the data. If you need to edit or correct anything, you can push the back button and it'll take you back to do any corrections. Sorry, I'm just trying to see what it says at the top there. Confirming the stock update. Okay, so select the accept tab to confirm the stock uptake. So that's at the bottom left over here. You click on accept and then you select OK to complete the update and move to the next stock item. To edit or correct updates, select the edit button. We're not going to worry about the loop through stock system because we'll be using a single item. All right, the minimum basket, again, I'm not going to take you through all of that because we literally have got one item we're going to be doing. So we will do it by one stock item. I should have removed those, I apologize. Okay, basic troubleshooting guide. So if an incorrect stock level has been submitted, so you've done all of that, you've accepted and you have submitted, and then you realize that something was incorrect when you sent it. Maybe somebody brings more stock or says they've counted correctly. All you do to correct that is repeat the stock submission process. Update the stock level for that item, and then you resubmit. The most recent entry will be selected and displayed as the stock level for that day. So basically, it will overwrite what you previously sent. After resubmitting data, sync your device. Inaccurate data entries can only be corrected for that day. So if you made a mistake yesterday, it won't overwrite it today. You can only overwrite something that was submitted today. Okay, after all the updates are made, check your main menu screen to see the last sync date and timestamp on the SVS desktop app. Select the sync button and wait for it to turn green, indicating the device has successfully synced. If you struggle to sync, you can also go to troubleshooting. Okay, this is some of the troubleshooting here. So if you need to go to the diagnostics page, navigating to that page, you select the 3 dots in the top right-hand corner over here. On the sidebar that opens up, you select the diagnostics here. Allow the app to run the diagnostics and wait for all the circles next to the diagnostics criteria to indicate if there is a problem. And here you can see here, the top one has got a red X. There's an issue that needs to be addressed. A green tick means there's no issue, and a bar means there is an issue, but it does not stop the app working. Something that you need to check is make sure that your computer has got the right date and time. All right, because the date and time, if it's incorrect on your device, it could impact the reported data. All the SVS data submissions are time-stamped using the time and date on your device. Every time the update banner, so here you can see a banner will come up. If the update banner appears on your app, ensure it is selected and that the app is updated. This is because they are continuously working in the background and the app itself may need to be updated. So on our computers, very often with Windows and what have you, this happens automatically. With this app, if you see that banner come up, please click on update so that you have the latest version. User support. So for operational information, you can contact Mr. Setembele Jara. Second line support would be support@mezzanineware.com. But I think the most important one is if you have any queries, you can always come first to ICPA. And certainly any of the MFL queries, I am the contact person to go to. We will then interact with Mr. Jara directly. So next steps, and here's just to give you an idea of some of the timelines that we've got. You'll know that the vaccination sites have been uploaded onto the master facility list. So phase 1B is done. We are currently busy with phase 2. We have, through Pharmacy Council, uploaded all of the pharmacies onto the MFL. So for phase 2, what we at the office now need to do is to go into your site and to tick the vaccination service box. This is the trigger for the Section 22A15 permit process. So we are busy with phase 2 at the moment. What I will be doing in the next few days is sending out a list of all the pharmacies that we have got information for, just so that you can check. Maybe your email went astray or something. I think it's important that if you want to be a vaccination site and you're not sure whether ICPA has uploaded you or not, we will be putting out a list of all the pharmacies. Confirming the organization's designated point of contact. So obviously the ICPA office is a designated point of contact, but what we do is we've put the RP as the facility representative. 3 is confirm the vaccination sites list. That we have already done. Confirm the preferred updating method. So ICPA has informed the SVS platform that our pharmacies will be using the web-based app. Confirm mobile numbers. If you're using the mobile app, we don't need to worry about that. Number 4, load the vaccination sites onto the SVS platform. We have already submitted a list of the phase 1B pharmacies. We are currently working on phase 2 and 3. Circulate self-enrollment guidance slides. So you'll see that is something SVS Help Desk will be doing, and they will be doing it in the next couple of days. 6, send out the SMS and emails for web enrollment. That's happening from the 30th of April to the 4th of May. Look out for those enrollment emails. And then the sites must self-enroll their device on the chosen platform. Yours will be web-based. The last thing is from the 6th of May onwards, you'll be starting to receive your vaccines. This is phase 1B. All right, and at this point, Mr. Chair, I'm going to hand back to you and I'm going to stop sharing, and then I can check the chat box. If anybody has a question, you can just put your hand up. If you look on the bottom, there's a thing that says reactions. If you click on that, you can see your raise hand. raise your hand, and then we will call on you and you can unmute yourself. Chair, I'm going to hand over to you.
Thank you, Jackie, for the precise presentation and explanation. And I just want to reassure everyone that if it seems too complicated, there's an email that we will send out. It's got step-by-step of what the presentation that Jackie just presented now, so that you can familiarize yourself, and any area of concern, you will therefore be able to raise it. Perhaps it may look like a complicated system because we have not went into it. As soon as we go in, we'll get the hang of it. I just want to recognize Huawei P30 Pro. I noted that he put in the chat box that I am lost, which means it was total darkness for Huawei P3. Please go ahead with your question.
Huawei is me, Chairperson. This is Clady from Bloemfontein.
Welcome, Clady. Please ask your question.
Yes, my brother. Yeah, I got lost. I heard you talking about a token from the Pharmacy Council. Jackie talked about a token from the Pharmacy Council. And I know I read each and every email from Pharmacy Council. I've never received any token that she's talking about.
And you have applied to be a vaccinator?
I should think so, because I confirmed with Denise from the ICPA office. Yes, I did.
Did you respond to the link that the Pharmacy Council sent out?
They're sending quite a number of them, but I saw one that I followed through. I don't know if I was correct one, but I did feel whatever that he asked me to do.
Just check. Otherwise, we will be able to confirm through the office tomorrow, particularly on your case, and be able to give you specifically where you are. And
okay,
I
my
think
brother.
yours will not be a challenge here. But
Thank you, my brother.
if there is any other concern, just speak to the office. I'm sure Denise will be happy to assist you, or Jackie.
Yes.
Thanks, Clady, for the question.
Yes,
Jackie, you want to come in?
Yes. Clady, we'll have a look for you tomorrow. So basically, those tokens will be for the phase 1B pharmacy. So we'll just double check that you are phase 1B. And if you are, then we will get hold of council and find out where your token is. Just please, because a lot of these are going out, also check your spam. Make sure it hasn't gone into your junk mail. And remember that it will be sending to the email address that Pharmacy Council has on their register. So just make sure that you are checking that email address.
Is it the one that has got some invitation to do whatever? I saw the email that says invitation to register on whatever from Pharmacy Council. Was it the one?
We'll have to have a look for you. I'm not sure, but we will double check.
Lovely. Thank you. Thank you. Thank you so much. Thank you.
Thank you, Clady. Please remember to put the hand down so that I don't call you again. And
okay,
I think Elaine van Eden also put in the chat box, is the received quantity that is shown on that system, the quantity only of the items received in that particular day. And thank you, Sham, for the answer there. Yes, it is the stock that you received on that particular day, just like the current stock systems that we are using. So if you have received 10 today, it will the amount received is 10, not added to the other 10 that you already had. So you received 10, but the total that you have will be 20. Thank you for that question, Elaine. Any other question? Do you see any hand, Jackie?
So Chair, I think Elaine has put another question. She says, is it possible to change the facility rep from the RP to another email? Elaine, I'm not sure if you're talking about on the MFL or the SVS. We can change them. We would rely on the information that you sent in to us. So maybe if you just drop me an email, and then we can double check for you which system are you talking about, because there are 3 systems we work with these days, the EVDS, the MFL, and the SVS. And what information do you want it to be changed to? And we'll have a look at that for you. Anything can be changed.
Thank you for that clarity, Jackie. I see David Gray also in the chat box. Do you have to have a recent CPR certificate? Do you want to elaborate, David, or Jackie, do you understand?
No, I think I understand that. So one of the things that you will need to do when you do your compliance checklist from council is that a vaccinator, if that's the nurse or the pharmacist, you must be competent to be able to vaccinate. And one of the competencies that's required is to be able to handle anaphylactic shock. So you would need to know how to administer adrenaline, how to recognize anaphylaxis, and possibly do CPR. So I would say to you, if you are concerned that you don't know how to handle that, then you are not compliant yet and you need to get further training. And in fact, Chair, there is one of the questions we can ask the people on this training tonight is whether they would value some training on how to identify and handle anaphylaxis.
Correct. I think just to add there, while we're waiting perhaps for responses in the chat box, if it will be preferred that way, let's just indicate in the chat box that the training on the handling of anaphylaxis will be appreciated so that we can take it from there. But another important point to note is that Jackie indicated that SOPs will also be sent that should be able to assist as a resource in the pharmacy so that you can be able to respond to certain things appropriately. But I think we are able to assist with any training that will be required. I think Dorian there, Jackie, says training will be great.
Yes.
So it will be training perhaps, Jackie, on anaphylaxis. What else can we put together, perhaps just to make a one-stop shop training, perhaps injection technique, just to refresh, as well as the handling of this anaphylaxis and all the other emergency concerns. I think there is an overwhelming response in terms of that training. Jackie?
Thanks, Chair. So we have got a provider who can give an update on the identification and treatment of anaphylaxis. It would be an online course, but there would be a webinar that needed to be attended as well. So I'll get details of that and we will send it out in an info flash. Chair, there is a question from David Gray. I don't know if you can see it.
I see it, Jackie. Have you read it? Can you assist?
Yes, certainly. So he basically says, hi team, please can you clarify how one should proceed with caution in individuals with bleeding or clotting disorders? Does this include clients on blood thinners, previous strokes, MIs, estrogen, smoking, non-steroidals? Does that mean we give it or we don't? All right, so I think, David, if ever in doubt, then rather refer. But what I can say to you is that there is no reason somebody on ordinary blood thinners, your people coming in that are on warfarin, there's no reason that they shouldn't be vaccinated. And in fact, I was listening to a specialist the other night, and he said people at risk of clots should absolutely be vaccinated, because if you are at risk of a clot, your risk of dying from COVID exponentially increases. But within your scope of practice, if you are confronted with a patient whose medical history you are unsure about, then rather refer them to go to a doctor's practice to get clarity. Don't do something you're not sure about. Sham, I don't know if you want to come in there a bit as well, because I know that you've listened to a lot of this talk on these things as well.
Dr. Moodley?
Jackie, I think what we need to do maybe is to look at some of the guidelines around the contraindications for the vaccine. So far, we know about the pregnancy, we know about breastfeeding, and that's why we had to refill that consent form. And there's one or two other things. But I think what we must do is just clarify that in a proper document and circulate it to our members. That's the first thing. And I think you're giving really good advice in terms of if you're not sure and you've got a patient that you are unclear about, rather consult with their GP or their specialist and say, what do I do? Do I go ahead and give them the vaccine and try and get some coordination together with them? So if you're really unsure, you can ask for them to get advice from their GP and come back with a prescription to say that they're allowed to have the vaccine. I think that's probably the easier way to handle it. In my area, we set up a strategic team and we're going to be working rather than the pharmacy doing the vaccines itself, we're actually going to be working in a joint team approach in the area and doing it together with the GPs, the local nurses, and some of the community members to assist with this. Thanks.
Thank you, Dr. Moodley, for the clarity. You are correct, because according to the National Department of Health also, they do acknowledge that where there might be some contraindications or where there are concerns of unsureness whether to enroll for the vaccine or to get a vaccine, the patient is also responsible to get clarity from their consulting GP, so that when they come, they have already been cleared of any concerns regarding their taking of the vaccine. So they can just be referred back, or the doctor can just be called to confirm in writing if this patient is eligible for vaccine, so that we do not have unnecessary claims against our professionals. Any other questions that you see there, Jackie?
Yes, so we've got from Johan Mulman. He said, I've tried several times to do a booking for my vaccination. It keeps on saying unable to make a booking. How do I go about it? Johan, if you could just drop us an email, let us have a look there. It could be a number of different issues. The first thing is we must make sure that we actually uploaded your information. The second thing is, are you registered on the EVDS? The third thing is, are there vaccine slots available in your area? So there could be a number of different reasons for that. But if you just drop us an email, you can send it to info@icpa.co.za, and we will get back to you and sort this out for you so that you can get your vaccination.
Thank you for that, Jackie. And Sham, while you are still on the line here, can you please assist those that are finding an error that says NF? I know that you have put out something on the WhatsApp group with regards to the NF message. I think the Gauteng guys are struggling with the NF message. Sham?
Yeah. So we did find somewhere in the process yesterday what that indicates. So it means that you have not been released as that frontline option at the moment, which is the pharmacist, post-basic, and nurse. And the reason for that could be that you were not uploaded from the ICPA office or from the PSSA, or if you worked for any of the corporates, for example, if you were not on their list that was uploaded, the two systems are not talking to each other. So that's the problem. So if you get that, please contact the office, send an email like Jackie is suggesting. Let us check if you are on our list that we uploaded. If you're obviously not on that list, then we're gonna have to find a way to, we did a submission today, Jackie, submission number 7, that was, and I saw probably about 60 or 70 people who didn't do the process properly the first round, sent us their names, we resubmitted today, and they should be able to get onto the system. So that's the process that we're asking you to recheck, send a mail to the office, let us try and deal with it for you. Thanks.
Thanks, Dr. Moodley, for that. And I see Simone there has put a message as an advice to say, wastage of doses. If a patient does not pitch for appointment, or one has a patient who we are doubtful to vaccinate or not, as discussed just now, could one grab an available patient not to waste a dosage? From my own point of view, you'll correct me, Sham, I think it will be prudent to put the next patient in line because the vaccines are not marked for a particular patient. Sham?
Chair, I think what we need to do is trying to get clarity from the Department of Health in writing on this issue. And I think once, by the end of this week, once the pricing section, there's quite a big meeting tomorrow, workshop tomorrow, on the pricing section and all of these waste issues, etc. We will deal with it there. So our suggestion to them has been that we have a standby list. In other words, in your community, there might be someone with vouchers, but they're not booked for the day, and they could get to you in 10 or 15 minutes. They're around the corner. We could put them on a waiting list, and if you don't get people turning up, we might want to utilize that voucher and then do the claim on that. But that, as I said, still has to be clarified and ratified, both to the medical aid scheme, who are paying for the vaccines for these patients, and if they're not on a scheme, they will be on a government platform, and we're going to get clarity from government as well. So anyone allocated to you, that's government, government will pay for the vaccine. You don't have to pay for that through a voucher system, but they will pay for the cost of the vaccination. And we're still working out that number. We'll get clarity in the next 24 to 48 hours. Thank you.
And I
Thank
think,
you, Dr. Mutlu. Jackie?
yes, so the next webinar we're going to be doing is going to be on the EVDS, which is the Electronic Vaccine Data System. On that EVDS, as pharmacists, there is a whole scheduling component to that platform. Now, what will happen is people will be allocated to your pharmacy, so you will know ahead of time how many people are coming. It is on a 2-week or 14-day rollover. So people will be allocated to you in 2 weeks' time. So you will always have a list of who is coming to you. And quite rightly, as Sham has indicated, you could, if somebody doesn't pitch and it is going to happen, or they couldn't have their vaccination because they weren't feeling well, they were feverish, then you could call up a patient that was supposed to be coming in the next day or later in the day. The bookings will be in 2-hour slots. So you will, if you say that you can vaccinate 10 people per hour, then the EVDS will schedule 20 people in every 2-hour slot. So your slots will be, if you're open from 8 to 5, your slots would be 8 to 10, 10 to 12, 12 to 2. And you will be in complete control of that scheduling. So if, say, for instance, on a Wednesday, you only have 1 vaccinator, you can actually reduce your capacity on those days and you can put your hours in. So that will be the next webinar we'll be doing, which is going to be on the scheduling. So you as the pharmacist will have complete control over how many people are coming, when they're coming, and that will feed into the SVS so that you've got the stock when they do come. Chair, it is 8 o'clock. I see there are a few questions. I don't know if you want to continue, Chair. We did say it was for 1 hour.
Thank you, Jackie. I think there is just a follow-up from David, just to clarify that they will only be able to download the EVDS system after the acceptance on the MFL, or is it able to be done even before you accepted, Jackie?
Sorry, Chair, just read that again.
The EVDS system, when we now download it into our own pharmacies, do we wait first to be approved or accepted at the MFL list for the department before we can download the EVDS? That is for scheduling you were speaking about. Or do we wait until approved for MFL list before you can download it?
Okay.
I suppose it will be covered in the next webinar, but perhaps just to give the heads up.
Yes, so I think David may be referring to the SVS, the Stock Visibility System, because we haven't done the EVDS yet. So you will only receive an enrollment email once the facility has been approved. So we've sent the list of approved phase 1B pharmacies. They will be the ones that will be getting the enrollment email. You can't enroll onto the SVS unless you are invited. So you first would need to be approved on the MFL. The MFL and the EVDS, it's the same thing. Unless you've been approved on the MFL, you will not have access into the EVDS. So they all feed into each other.
Thank you for that clarity, Jackie. I hope it assists. Oh, yes. David acknowledges that. He says, okay, thanks. With that, Jackie, since it's already after 8, indeed, I just want to take again this opportunity to indeed acknowledge in retrospect the presence of the PSSA and the SAPC through Dr. Mariette, as well as Ndade Pasha, and to indeed thank everyone from the office of the ICPA, Jackie, yourself, Dr. Mutlu, and the entire board of the ICPA for this training tonight that they've made it possible. And I also want to take the opportunity to thank everyone that attended tonight and appreciate the participation. I don't know if I've skipped something. I see Ndade Mutlu with a hand there. Sham, quickly.
Yeah, there was one question I think that we didn't get to, and that was if you're getting delivery from one of the chosen vaccine suppliers and you don't have an account with them, what will happen? I think we're going to raise that, Jackie. We'll raise that with the supply team tomorrow in the meeting and see what the strategy is there. They probably will have to open that account for you because that delivery is going to come via Department of Health to them, through them to you. So we'll raise it and we'll answer that question going forward. Thanks.
Thank you, Sham. I'm sure we can handle that as we go along. Yes, the person that asked that question, perhaps it will be just good, just drop an email quickly to the office at info@icpa.co.za, and then they should be able to advise as to how the accounts will run. I saw another one was asking about 90 days. Those are some of the things that are still to be cleared with the B4SA, and then communication will be sent out. But without further ado, I just want to thank everyone. And indeed, I hope it was useful and worthwhile to attend tonight. Any further concerns we will handle through the office. So by so saying, thank you very much. We appreciate your presence and your participation, and good luck as you keep safe as we assist our nation with regards to this pandemic. So thank you very much and good luck with your future endeavors.